This is Dr. Juan Ruiz, allergist and immunologist. Today, I will be talking to you about allergy immunotherapy. Disclaimer: the following video is not meant to be taken as medical advice. Please check with your healthcare provider. This video is purely educational. What is allergy immunotherapy? Well, the short answer is it's a series of treatments which will make you less allergic, usually by introducing the things that you're allergic to. Ultimately, the goal of therapy is to decrease your allergic symptoms. What are the contraindications for immunotherapy? First, severe and uncontrolled asthma. Second, certain blood pressure medications such as beta blockers and ACE inhibitors. And lastly, any medical condition which would make it hard for you to be resuscitated after an allergic reaction. How long do the treatment last? Usually the treatment lasts between 3 and 5 years. Immunotherapy will decrease symptoms by 30 to 50%. Subcutaneous immunotherapy, or more commonly known as allergy shots. These are a series of injections that are injected on the subcutaneous fat, typically done on the posterior side of the arm. Immunotherapy starts at a small dose that it's increased on the weekly basis for the first 6 months. There are a total of 4 vials. Each one is a tenth of a dilution of the other. Over the next 6 months, you will slowly work all your way up to vial number 4, which is the maintenance vial. Once you reach maintenance, you will space out injections to once per month. You will continue with the monthly injections for the next 3 to 5 years. What is the risk associated with immunotherapy? The most common risk is large local reactions. These are urticarial plaques or hives which appear at the site of the injections. These are often more than 10 centimeters by diameter. The rate of these large local reactions is 1 in every 20 injections. The risk of anaphylaxis or a severe allergic reaction is 1 in 2,000 injections. Anaphylaxis is a multi-system reaction which could be fatal, usually characterized by hives, swelling or angioedema, coughing, difficulty breathing, and chest tightness, upset stomach, as well as an elevated heart rate or tachycardia and low blood pressure, to name a few. These types of reactions typically require treatment with epinephrine. Shift gears to sublingual immunotherapy. Sub meaning under, lingual meaning tongue. So, little pills that you put under your tongue. There are 4 types of sublingual immunotherapy. Ones that target dust mites, tree pollen, grass pollen, and ragweed pollen. In BC, dust mites are around all year round, while the trees are usually around from February to June. Grasses are typically out from April to August, and thankfully we don't have any ragweed in BC. In terms of sublingual immunotherapy side effects, the main side effects include itchy mouth, itchy throat, and upset stomach, as well as swollen tongue or swollen lips. There's also a rare side effect called eosinophilic esophagitis, which means allergy of the esophagus, which is the food pipe. This side effect leads to difficulty swallowing and retention of food. Fortunately, eosinophilic esophagitis is reversible once therapy is stopped. Lastly, to compare sublingual versus subcutaneous immunotherapy, we will compare the advantages and the disadvantages. Firstly, with sublingual immunotherapy, you can do it at home, which is more convenient, and there is less risk of anaphylaxis. However, the cost of therapy is substantially more than the injections. Lastly, for sublingual therapy, you need to use 1 pill per antigen. For example, if you're allergic to dust, grasses, and trees, you have to take an individual pill for each allergen. On the other hand, the injections need to be done at a clinic. The risk of anaphylaxis is 1 in 2,000 injections. The cost is a lot less than the sublingual, and you could actually put multiple antigens in a single vial. For example, if you're allergic to cats, dogs, grasses, and trees, you'll be able to put that all in the same vial. Please note that there is a lot more advantages and disadvantages, and you should consult with your staff allergist. Thank you for watching this video. Please like and subscribe.